Good afternoon, Facebook family. Welcome to our session today, protecting your eyes during the carnival season. This weekend is Carnival weekend, and we are so excited to have a session sponsored by Trinidad Eye Hospital.
When we started our eye care journey, our goal was to make high quality eye care available to all. We are committed to the continuous development of a comprehensive eye care service. We are Trinidad Eye Hospital, preserving sight, enhancing lives.
Okay, welcome back, and thank you for joining us. Today, I want to introduce our panel. We have our senior resident, Dr. Vikash Badasee, and we have our optometrist, Josiah Ambris, who are on our panel to answer your questions. Because during Carnival, the last thing some of us thinking about is our eye health. But there are things that we should be thinking about. So I'm so happy to welcome you and welcome our panelists to this discussion. I want to encourage you to listen closely, ask your questions. But first, I will open the floor and ask Dr. Badasee the first question, which is, what are some of these common eye issues that can occur during the festival of Carnival and all the festivities taking place?
Oh, hi guys. Yeah. So yeah, some of the things that we always, well, most commonly seen in carnival season is injuries to the eye from objects, foreign objects like you know, costume props or people throwing objects as well to in crowded spaces. We can also see that from especially Juve season, the Juve festivities, in injuries in the eye from things like pains or mud. It can enter the eye and cause irritation. Also, infections we see on the rise sometimes on carnival season from unsanitary makeup. People wearing contact lenses as well, to colored contact lenses, especially if it's not handled with clear or it's handled uncleanly with a dirty hand. And lastly, UV damage from prolonged sun exposure.
Wow, that's quite a list. I mean, I
Yeah,
think it sounds like wearing shades for Carnival is actually a protective decision more than a stylish decision. Would you agree?
yeah, I do agree. Yeah, yeah.
Yeah.
Yeah, shades. Yeah, give us a lot of protection from both things. It could potentially stop objects from hitting the eye, and it could also definitely prevent from UV exposure from sunlight.
Right, right. Yeah, because I never thought about the mud getting into your eyes for juvie. That's a really scary thought now that you mention it. So,
Yeah. So like fun fact, actually, that happened to me once. In fact,
oh,
um,
and
yeah,
how you dealt with that?
a couple of years back. Yeah, I was in juvie a couple of years back in my younger years. Still
And
young,
did the
but
eye
yeah, a
get in?
couple of years. Yeah. No, well, I'm not sure. It wasn't either. It was for juvie. It was either mud or paint or something like that. But I was just there, and something went in my eye. I didn't think anything of it. I tried to blink it off, but it didn't. It didn't come off. It was very irritated and red. So I just had to pull to the side. I got 2 bottles of water from the moving trucks, and I just washed it out. And so I just kept on washing it, and eventually it eased up, and I went right back in.
Wow, I think that's a
Yeah,
great tip. So just continue to wash your eye if something gets into it and you have no other choice but to stand on the side of the road and wash it out. Okay, that's a great
yeah,
tip.
yeah.
Josiah, do you have anything to add about some of the problems you see as an optometrist at the TH Optical?
Yeah. Just to touch base on what Dr. VDC is saying as well with the washing of the eye. That's a good important tip. But only if water is needed, they should use water other than I try to use saline as much as possible. Other than that, in terms of common issues that actually happen with the eyes. From an optometrist point of view, I would say more dryness of the eyes as well as the exposure from the sunlight could be very harmful to the eyes. In terms of dryness to the eyes, you're thinking about like environmental factors like dust. You're thinking about things like pollen, things moving around in the air that could eventually happen to get in the eye, irritate the eye, even if I don't wash it out, it leads to other serious problems in the eye other than irritation. So you just want to be mindful of that, the dryness of the eyes. That's one key thing there.
Okay, sounds like something we should be thinking about because even when we're not playing Carnival, the dryness of the eye is an issue, especially with the Sahara dust. So when people in the savannah with the dust raising up, I mean, I could
Yeah.
imagine it would be more of a risk for the eyes, right?
Yeah, and then in an instance like that as well, the shades could be in handy because, as Dr. BDC says, the first line protector against things, physical things actually getting into the eyes. You know?
Right, I understand. Well, thank you guys. I wanted to ask another question, Um, what, I mean, we always say prevention is better than treatment. So, what steps, apart from the shades we talk about, is there anything else you think people could do to protect their eyes during the carnival season? And I think that question I want to ask Josiah, if you could tell me what you think people could do apart from shades.
Yeah, so apart from shades, in terms of treatment of the dry eyes, you could use there wide variety of different eye lubricants that you can use. Particularly, you want to go to your eye specialist so that they could prescribe one, particularly for the different type of dry eyes you might be carrying. You know, so that's one way you do that. And next way is it could probably be prepared in terms of like carrying a little pouch around just so that you could always have that first aid in case anything actually happens on spot
Right.
and they don't have that medical attention around, you know?
Well, that's a good idea. I didn't think about that. Most people carrying a little bit of money and their cell phone.
Yeah,
But you could probably pack a little eye drops in there too.
yeah, a little hand wipes. It have lid wipes now that biotrue lid wipes that you use to clean out the eyelids. You pack your hand sanitizers, you pack your eye drops, you pack a bottle of saline just in
Okay.
case, you know.
Interesting, interesting. And what about the contact lenses during that time? Is that okay to be taking out your contacts on the road, putting it back in? Like, what is your advice on that?
I believe it all depends on the type of contact lens that is carried, or that is prescribed to you, I should say. Most of the time, people for Carnival will want to go to the pharmacy and just get like a colored contacts.
Right,
Usually, you want to go to your medical provider so they can give you the right contact for the eye because contacts have a tendency to deprive the front of the eye from oxygen, and that could be harmful to the eyes. So you need the a specific contact lens, one for your type of dry eyes, and well, two for your prescription, and then three need to be from a trusted source. So that way, enough oxygen is getting to the eyes, the comfort and everything of the lens is safe for the eyes. In terms of the lenses not falling out of the eyes, in
right.
terms of disposable lenses, the best thing to do, you can just throw them away because they are disposable. If that's not the instance or if that's not the case, you might have in your pouch as well, your first aid pouch, you might have as well your contact lens case and some cleaning solution.
Okay.
Yeah. So if the lenses was ever fall out the eyes, you could just pick them up, give them a nice clean with the multi-purpose solution. Yeah, a nice clean, nice irrigation. That's if it's not disposable, of course. Nice irrigation, and you go ahead, you lubricate the eye, and then you reinsert. Once you
Okay.
do the right hygiene, yeah.
And of course, yeah, hands have to be clean for that
Yeah.
because, you
That's
know.
where the hand sanitizer will come into
All
play.
right, got it, got it. And Dr. Badesi, you have anything to add to
Well,
that?
no, I mean, Josiah covered it, but just to reiterate, yeah, the use of shades, shades, in particularly polarized shades sometimes, they can help prevent a lot of the exposure to the UV light because UV
Right,
light, intense exposure, it could cause inflammation to the front part of the eye, where we call the cornea, which is a clear
right.
window. That could be very painful. And if that happens, you definitely need to go and seek medical attention.
Of course.
So yeah, yeah. And just to know, in these fetes and these for Monday or Tuesday on the road, Juve, whatever, there's always a like an ambulance or like a first aid. There's always a first aid station. So if you feel like you get anything in the eye, it's irritating, it's very uncomfortable, something hit the eye, they usually are set up with some small things like saline solutions or eye washes to help immediate intervention. So make sure if that happens, anything with the eye happens, you go seek them. Don't feel you're all big and you're okay. Or, you don't want to spoil the line. Yeah, don't worry about
Yes,
that. Yeah,
exactly.
you just go and seek attention from the first aid centers. They might wash the eye with saline, or they might check to see what's going on, and then they will determine if they need to carry you to the hospital itself for further management.
Yeah, I think that's such great advice because, in the heat of the moment, people mightn't be thinking to look for the ambulance or to go because they're thinking that's for if something serious, like a serious injury, bodily injury. But your
Yeah,
eyes are part of your body and they're prepared to treat the eyes as well if something happens on the road.
yeah,
Okay.
yeah. A lot of patients, yeah, don't
That's a
think about
very
that
good
definitely.
reminder. Really good reminder. So I was wondering who, I mean, so you said that, if somebody experiencing an eye issue, that's what they should do. First, go to the ambulance. But,
Hmm.
sometimes people have these allergies and, so they may not have an injury, but
Hmm.
the dust maybe give them a spontaneous allergic reaction and they start rubbing the eyes and what would you all recommend if something like that happened? I mean, I don't know if Dr. Badesi, you want to continue and let us know what you think.
Yeah, so for those purposes, and if you are known to have allergic eye disease, you know that the eyes get red or irritated from time to time, just make sure walk with some lubricating eye drops, and there's a lot of anti-allergy eye drops on the market as well. Just like you take
Right,
a just like you take a Allegra or a Panadol colon flu or a Panadol tablet for your sinus problems,
right,
eye drops for allergic eye disease. So if you know you're prone to that, make sure walk with your eye drops. And if it is occurring in wherever you are, if it's occurring like you get an attack or a flare up, just avoid rubbing the eyes because that can make it much worse. And then you don't
right.
know what contaminants your hand have in it, so that could actually make it even more worse. So
Yes,
yeah, work with your eye drops. Use them if you can't. If you forgot to work with them, make sure go see the emergency section of the party. And if you're experiencing blurred vision or severe pain, photophobia, again, make sure see the emergency section or get to the hospital
right.
as soon
Great
as.
advice. Thank you. And that antihistamine eye drop, those are over-the-counter drops. It's not something you have to be prescribed, is it?
So some of the basic ones, yeah, over the counter. But some of them are prescribed.
Right. So
So
it's good
yeah,
advice that if you have a prescription, you should walk with your drops on the
yeah,
day
yeah,
in case
yeah. If you have
something
a
happens. And,
yeah, you should
that's
stock up on it. Yeah,
right. So I guess these masqueraders have to make a checklist now to make sure they could have a good time, right?
yeah,
Because
yeah,
something like that could really ruin a good time, like you said, spoil the line, right?
yeah. It can definitely.
Yes. So I have another question. I was wondering about um the the sunburn to the eyes. I think you mentioned a term earlier,
Yeah,
photophobia, and what is this sunburn to the eyes? I don't know who wants to take that question, if Dr. Badesi
yeah.
or yeah, Dr. Badesi.
Yeah, yeah. So when the eyes exposed to a lot of sun rays, and some patients, and not all patients will happen to not all people, but it can actually irritate the front surface of the eye, called the cornea, it can cause some inflammation. Medical term is photokeratitis. So
Right,
inflammation to the cornea, and that could be a lot of severe pain and glare, light sensitivity. So if that's an issue, if that occurs, what you have to do is to use lubricating eye drops as well. So your artificial tears, which is over the counter eye drops. So again,
right,
we come back to the fact that you should have just like you have a Panadol or Advil in your party bag, you should have lubricating eye drops at least in your party bag itself.
right,
So you can use that if you get that inflammation, you could from the sunlight you can use lubricating eye drops. You can use it often, very often in the first couple minutes. Also, you could use something cold to just rest on the eye because that is
right.
shown to reduce the inflammation Anything
Right.
cold you can get your hands on. So sure you're gonna get your hands on ice or a cold drink or something,
And you
and
just
you
put it
rest
on
it.
the closed eyelid, like you close the
Yeah,
eye and you put it on the
yeah,
eye
yeah. You
until
close
you
the
feel
eye.
relief.
Yeah, until you feel relief. And obviously, if you don't feel any relief, you seek attention.
Right, right. Okay.
Um,
Interesting.
just
Yes,
to touch
Josiah.
base,
Hmm.
there as well. Going back to the polarized shades, you actually need that to protect it from the UV. Now, some people will go to the pharmacy and just buy a shades, which is just tinted. That actually just protects that from the light intensity, not the UV rays. The UV will still penetrate the tint and affect the eye. So you must be particular in the polarized part of the shades in which you buy. You know, it must be polarized.
Correct.
Okay. Well, that sounds good. Again, another reason to have shades for Carnival and not just the one, but you need proper shades, right? It's not just any shades. That's the advice. You muted.
Correct.
Yeah,
Correct.
correct. Okay, good. So we
Polarized
have a
shades.
question from our Facebook family who has joined in. And the question is, what brands or types should we use? Like, so I know you said polarized. Like, is there a popular brand? Or is it that all brands come polarized? You know, what should we ask for when we asking a pair of shades for the road?
Essentially, you want to ask for UVA protecting and UVB protecting, yeah, from the polarized aspect of the shades. So once the brand carrying either or, you're safe to go.
Okay. All right. Good. That's a good tip. I think I want to open the floor. Thank you for your question. I think that question, we have another question from Rajiv. He's asked if one is short-sighted, how would the shades help?
So the polarized shades at Trinidad Eye Hospital Optical have the availability to hold prescriptions. So that way we could always correct the refractive error while protecting the eye at the same time. Yeah.
Yeah.
So that's
So
available.
I like that point you're making there because you know sometimes people might be tempted to buy a nice looking shades in the mall somewhere, right? Maybe in the pharmacy, and they might want to bring it to the optician, the optometrist, and ask them to test to put in a prescription for them in that pair of shades. But they might be very disappointed if for some reason that shades cannot hold a prescription lens. But could you advise on is that even possible that you could buy a shades in the pharmacy and then bring it to the optometrist to test the lens?
No, it is possible. Is it advisable? Only if you have trust in the durability of the product you bring in. Yeah, the product we will provide, we will have more reliability in them. Each local optical provider will have done the research and have reliability in the products they're providing.
Right.
Um, if you have if you have faith or trust in the product you bring in from the pharmacy, feel free to do that. However, the better option will be to choose a frame, particularly to your face, with the help of a certified optician or an optometrist there that could actually give you the size of the frame and the depth of the frame for your prescription and the type of prescription. So whether it be progressive lenses or whether it be just to see at distance. Yeah,
Right. So I think what I'm hearing you say is once you want a prescription in your shades, you should go to the professionals
correct,
to choose that
correct,
frame and not buy
correct.
it in a pharmacy and bring it because you could be disappointed. It might not
Yeah,
work.
yeah, you will be disappointed. You will be disappointed.
Okay, that's good advice. Thank you for that, Josiah. I have
No
another question coming in from our viewers. One question here is about contact lenses. Again, like how long can we leave the contact lens in the eye? So, like, let me give you a perfect scenario. Some masqueraders have to wake up like 4 a.m., maybe 3 a.m., depending on how long the makeup list is, to do makeup. And they may get ready, put their contact lens in, and go to the makeup appointment. So let's say they go to the makeup appointment and it's 5 a.m. And then they don't get home till after last lap at 10 in the night or something. And they would have had the contact lens on from 5 a.m. straight to 10 p.m. Is something like that okay?
So, as I said before, contact lens have a tendency to deprive the eye of oxygen. So, when you actually do go to a contact lens certified provider, a optometrist or ophthalmologist, what they will do is determine the modality of the contact lens specific for you, whether it be dailies or 2 weekly, so that way you know how you handle the lenses, and also they will determine how dry the eyes is, so they will know
Okay.
what daily disposable to give you and the material to give you, because certain materials will allow different types of oxygen into the. So when you go there, we will determine what wear time you will get out of the lens, and then we will
Got it.
advise
Okay.
how you should wear the lenses. Yeah. So for max, most people can get at least 14 to 15 hours wear time.
Okay.
From
Okay.
there, you just take the lenses out. Well, you could lubricate the eye as well. You take the lenses out, and if it's disposable, you dispose of it. If not, you do your lens handling.
Okay. I really like that because what you're saying is all contact lenses are not created equal and all
Correct.
patients don't have the same eyes. So
Correct.
clearly you have to follow the instructions of your optometrist,
Yeah, your provider.
your contact lens provider.
Yeah,
Whoever that is needs to guide you on the wear time and everything you need to know about wearing it correctly. Is that what you're saying?
correct. Correct.
Okay, great. Thank you for that advice. We are opening the floor for more questions, but let me see. There's a question I have here, another one, while we wait for some others to come in. What is the risk? And this question is for Dr. Badasee. When it comes to wearing false eyelashes, a lot of women want to have the long eyelashes during the carnival season, not just for the costumes, but also the new trend is in all the parties, everybody's wearing these long eyelashes. And it's very intricate process. It takes a lot of time and people may forget they have it on. What are the risks of wearing these eyelashes during the carnival season?
Yeah, so yeah, it's a common thing we see as well too. So yeah, the risk of eyelashes is something foreign in the eye itself, around the eye itself, and you always risk inflammation and infection. So if you have contaminated eyelashes, whether it be from the person that put it on or just the eyelash itself has a kind of contamination in it, it can get from the eyelids all the way into the surface of the eye itself and cause inflammation to the layers there. And that will cause a lot of pain, irritation, running water. So those are symptoms of eyelash-induced inflammation or infection. It could also affect your vision as well. And if these things happen, due to eyelashes, fake eyelashes, you definitely need to go see our eye care provider to determine what type of damage or what type of issues is going on, if it's inflammation, infection, because depending on that, you'll need specific medication, prescribed medication to treat.
Right, right. But I mean, you said that, and I just want to know your opinion in terms of risk. So is the risk of in contamination so high that you would advise against wearing the lashes? Or do you think it's a risk that's low enough that you could take a chance?
Well, yeah, that's a hard question. That's a tough one to answer, yeah. But no, I mean, yeah, you can't take the chance, put in eyelashes. Just make sure you practice sterile technique. Make sure it's
Right,
a sealed container that
right.
contains the product itself, a reputable brand as well too.
Yes.
Um, if
Mhm.
you go by someone to put it on, you make sure the person itself that doing it, is
Yeah.
a reputable person and practices good hygiene. And or if you're doing it as well, make sure you wash your hands and you get your tools and you do it.
Yeah.
properly. But I
Okay.
mean, still, even given all of these things, there's still that chance. I mean, we don't have any
Yeah.
figures. We don't have any figures as to what percentage. Um, but I can't say no, don't do it. It's a part of
Yeah.
the culture. Obviously, if we
But
don't have to kind of avoid it, the better. But if it
yes.
does happen, but if you do happen to do it, and just have in mind that if you do put on eyelashes and you get these symptoms, redness, pain, burning, make sure you take them off, or you see a professional right away to treat it.
Okay, that's such great advice. Thank you. I mean, sometimes, people don't really look for those characteristics in the place, you want to make sure it's a clean environment. And I really think that those are things that could really save you a lot of problems, if something actually does go wrong.
Yeah.
So really appreciate that question. So we have one more question before we wrap up, which is, and I think you answered a lot. Both of you had touched on many of the eye problems, but if you had to say what are the most common eye problems that arise through Carnival, like I think you kind of covered it. You said you all were talking about irritation to the eyes, but let's get the optometrist perspective and then we get the doctor's perspective. So from the optometry side, on Ash Wednesday, Josiah, what is the most common thing that you see?
Probably paint in the eye, if anything, but that's after treatment and everything like that, you know. Or what usually happens in contact lens patients is they might overwear the lenses.
Right,
So that's one thing you might want to just be aware of, not to overwear your contact lenses.
right. Okay,
Yeah.
good tip. And Dr. Badessi, what have you seen on Ash Wednesday in the clinics?
Yeah. The most common things is inflammation or infection as the top one there. Inflammation, infection, they kind of go hand in hand. And again, that's from all the makeup, on the eyelashes,
Right,
sometimes, the exposure to the environment itself, a lot of Sahara dust as well in the air and heat as well. So inflammation, infection, that'll be the top ones that we manage
right.
on the days after Carnival.
Right. So, okay, this was a great conversation. I mean, I think the main takeaways are to walk with your eye drops, make sure you do things very clean and hygienic when it comes to applying makeup and sanitary conditions and instruments and, wearing the proper shades. I mean, we got so much good information here on this call this afternoon. I really want to thank you for answering these questions. I want to thank Facebook population for joining on and asking questions. I don't know if we have any parting tips for the carnival season from Dr. Badessi and then from Josiah before we close.
Yeah, so yeah, again, that's the basic summary there. Just enjoy yourself, but do it wisely. Protect your eyes, shades, drops, and have a low threshold for seeking medical attention if anything happens with your eye, because it's a very sensitive tissue. So you don't want to mess around with it too much.
Great. And Josiah, thank you.
Yeah, so just to touch base on what Dr. BDC said, go ahead, enjoy yourself, make sure you're sterile, make sure you're well prepared. Try not to share too much of your personal items around
Yeah,
with
good tip.
friends because you might just get it's a free up time, so you might just not want to think about it, but try to be mindful not to share different towels, rags, makeup, eyelashes for the ladies,
Yes.
and go out there and enjoy yourself and be safe.
Great advice. Thank you, Josiah. Thank you, Dr. Badessi, and thank you, Trinidad Eye Hospital, for sponsoring this session. We do hope you have a wonderful carnival. Enjoy yourselves and just protect your eyes. So thank you and have a good evening.
Bye, everyone. Enjoy.
Enjoy.
When we started our eye care journey, our goal was to make high quality eye care available to all. We are committed to the continuous development of a comprehensive eye care service. We are Trinidad Eye Hospital, preserving sight, enhancing lives.